Hi, welcome back. My name is Kweku. I'm a pharmacist. Today I'll be reviewing the medication Gemtesa. Now, if you or someone you know struggles with frequent bathroom trips, sudden urges to urinate, or leakage episodes, you're probably familiar with overactive bladder. Gemtesa is one of the newer treatment options that was approved by the FDA in 2020. In the next few minutes, I'll cover most of the important things you need to know about Gemtesa, such as how it works, proper dosing, side effects, and important safety tips that I believe you should be aware of. Now, quick disclaimer that this review is for informational purposes only. Please do not stop, or make any changes to your medication regimen without first talking to your doctor. It's also worth noting that I'm not sponsored by the manufacturer of Gemtesa, nor is this video an endorsement of the medication. Just information to help you decide whether this is the right medication for you. So as always, let's start with the basics. What is Gemtesa? Well, the active ingredient or generic name is vibegron, but it's currently marketed under the brand name Gemtesa. As of the recording of this video, there is no generic option yet. Gemtesa belongs to a class of medications called beta-3 agonist. Now, it's FDA approved for treating overactive bladder symptoms like urinary urgency, which is the sudden strong need to urinate, or urinary frequency, which is the need to go to the bathroom often, and urge incontinence, which is the leakage or wetting accidents that can happen when you get that strong urge. Gemtesa is also approved for men who are taking medications for benign prostatic hyperplasia, or BPH as we commonly call it, to help manage some of the bladder symptoms. Now, what makes Gemtesa different from some of the older overactive bladder medications is that it works through a completely different pathway. Now, while the older medications can cause side effects like dry mouth, constipation, memory issues, Gemtesa typically causes fewer of these problems. Now let's talk about how Gemtesa works in your body. Now, so think of your bladder as a balloon filled with water, okay? In an overactive bladder, that balloon is overly sensitive and contracts too often, even when it is not full. Now, such contractions will result in the water in the balloon to spill out in our analogy here. So Gemtesa essentially calms down those muscle contractions, allowing the balloon to expand more and to hold more water before sending a signal to the brain that it is time to empty. So in pharmacy lingo, we say Gemtesa works by relaxing the bladder muscle, the one called the detrusor muscle, by activating these beta-3 receptors, allowing it to hold more urine. It also reduces those sudden urgent feelings that can lead to leakage episodes. Now, what's particularly good about this mechanism is that vibegron does not cross what we call the blood-brain barrier, which means it doesn't cause cognitive impairment like some of the older overactive bladder medications can. Now, let's talk about how to take Gemtesa properly to get the best results. So Gemtesa comes as a 75 milligram tablet that you take once a day. Now, you can take it with or without food. It doesn't affect how the medication works either way. Best practice is to take it with a full glass of water. Now, if you have trouble swallowing pills, you can crush the tablet and mix it with about 1 tablespoonful of applesauce, and then take it immediately with a glass of water. Now, do not let the tablet, if you decide to do so, sit around. Take it right after mixing. So in clinical studies, people taking Gemtesa experience symptom relief after about 12 weeks or so, with some reporting improvements as early as 2 weeks after starting the medication. Now let's cover some important safety information to help you use Gemtesa safely. So if you have kidney or liver problems, Gemtesa may not be appropriate for you. Your doctor may need to perform tests to ensure your kidneys and liver are working well enough before prescribing this medication. Also, if you have a blockage in your bladder or you are taking other medications for overactive bladder, especially the anticholinergic medications, talk to your provider before starting Gemtesa, as there may be an increased risk of urinary retention. Now, examples of some of these anticholinergic overactive bladder medications include oxybutynin or sulfenacin, which is the brand name is Vesicare. Now, when it comes to drug interactions, the main one to be aware of is digoxin, which is a heart medication. Gemtesa can increase the digoxin levels in your blood. So if you're taking digoxin, your doctor will need to monitor your levels more closely. Now let's talk about some side effects that you might experience with Gemtesa. The most common side effects include headache, urinary tract infections, common cold symptoms, diarrhea, nausea, and upper respiratory tract infections. Now, headaches were one of the most commonly reported side effects during clinical studies. These are usually mild and often improves as your body adjusts to the medication. Now, taking Gemtesa with food can sometimes help reduce some of the stomach-related side effects. Now, let's discuss serious side effects that will require immediate attention. These are not very common, very rare, but it's important to recognize them so you will know what to do in the event that it happens. Now, the most serious concern is urinary retention, which means difficulty emptying your bladder completely. The risk is higher if you have a bladder blockage or if you're taking other overactive bladder medications, so just something to be wary of. Now, signs of that would include difficulty starting urination, a weak urine stream, or feeling like you cannot empty your bladder completely. Another potential serious side effect is angioedema, which involves swelling of the face, the lips, the tongue, or the throat. Now, this can happen hours after your first dose or even after taking multiple doses. So obviously, if you experience any swelling, especially around the throat, this can be life-threatening and therefore requires emergency medical care. So I hope this video has helped you understand Gemtesa better. If it did, please give it a thumbs up, share with somebody else who may find it beneficial. And as always, stay blessed and I'll catch you on the next video. Thank you.